A warm welcome to our fat-soluble vitamin section. For the sake of going alphabetically, this sketch will be all about vitamin A. And what better way to celebrate than to throw a party? For you sketchy micro-watchers, do you remember our symbol for vitamin A? Hint, you'll find it atop the head of a weasel. You guessed it, the vitamin A party hat. Here you'll find it atop the head of the birthday boy, A.A. Ron. No, not Aaron. A.A. Ron. Glad we got that straight. Vitamin A is also called retinol. And since vitamin A plays a large role in vision, it actually makes sense that retinol sounds like the retina of the eye. What doesn't make sense is why A.A. Ron brought a retina balloon to his birthday party. Different strokes, I guess. Vitamin A comes from retinol esters and beta-carotenes, both of which come from dietary sources. It took us a while to think of a symbol for carotenes, but we finally unearthed what may be the most imaginative cue to date. Carrots. Oh, but not just any old carrots. For you, only the finest beta carrots. Which is also perfect for his birthday celebration because what young tyke doesn't request carrot cake for his 5th birthday? The birthday boy chose his favorite stuffed animal to be the theme of this party. A floppin', adorable, chubby bunny. Honestly, that bunny is kind of fat. Which will remind you that vitamin A is fat-soluble. Recall that the fat-soluble vitamins A, D, E, and K and other fats form micelles before getting absorbed by the small intestine. Retinol in your gut is absorbed in the small intestines, where it's converted into retinol esters, which are picked up by chylomicrons and stored inside liver stellate cells. These star streamers hanging from the tree represent stellate cells, formerly known as Ito cells. Retinol travels in the bloodstream bound to the retinol binding protein, but crosses the cell membrane and enters the nucleus as retinoic acid to modify transcription of genes. Why do we need vitamin A? Vitamin A is important for cellular differentiation and vision. Vitamin A and its metabolite, retinoic acid, are required to maintain orderly differentiation of specialized epithelia. Or in other words, vitamin A helps cells be different. Another way of phrasing that could be cellular maturation. And hey, these words of wisdom are pretty mature. Though I'd expect nothing less from a carrot cake eating sophisticate like our buddy A.A. Ron. Because of the name retinol, it's pretty intuitive to think of vitamin A as relating to the retina. In fact, vitamin A affects many different aspects of vision, not only the retina. Vitamin A, as retinol, is a part of rhodopsin, a light-sensitive protein that's important for visual phototransduction. To remember this, just take a glance at A.A. Ron's glasses, which sharpen both his vision and his image. Now let's switch gears. Before we talk about what happens when you don't have enough vitamin A, let's talk about why you might be deficient. We've included 3 rowdy kids to represent the causes of vitamin A deficiency. Not getting enough vitamin A from the diet causes deficiency, but it's rare. That's too bad. No carrot cake or vitamin A for you. And yep, that's what we're calling him. Get a better agent if you want to have a named role, buddy. Pancreatic insufficiency also contributes to vitamin A deficiency. For example, people with chronic pancreatitis can't produce enzymes that break fat. So vitamin A and other fat-soluble vitamins can't mix with lipids to form micelles and be absorbed. Rowdy kid number 1 has a pancreas-shaped fanny pack, but I don't think it works. Cystic fibrosis is another notable cause of pancreatic insufficiency, which is why this troublemaker is holding a sappy branch, the recurring sketchy symbol for CF. You'll also see rowdy kid number 2 lifting up his shirt to release all the streamers he stole. Wow, what did these kids have before the party? Aren't they a little young to be pre-gaming? Anyway, intestinal malabsorption, such as from inflammatory bowel disease or bariatric surgery, also causes vitamin A deficiency. Finally, rowdy kid number 3 snuck off with that bag of green icing, but he can't get anything out. Which, when you think about it, is kind of like cholestatic liver disease, when bile gets stuck in the bile ducts instead of going to the intestines. So we can't emulsify fat and absorb vitamin A. One of the earliest findings of vitamin A deficiency is impaired night vision, also called nyctalopia. This is specifically due to impaired rhodopsin formation. We've shown nyctalopia by adding some dark shades to this kid. Unfortunately, we've also added to his bad boy image. Dang, we gotta stop encouraging these rapscallions. Unfortunately, loss of night vision isn't the only vision-related sequelae of vitamin A deficiency. Blindness can even occur in severe cases. We've demonstrated blindness with this girl wearing a blindfold and playing pin the tail on the donkey. Seems like a great idea, doesn't it? Corneal epithelium undergoes squamous metaplasia when there's too little vitamin A. Remember that metaplasia occurs when there's reprogramming of stem cells, leading to replacement of one cell type by another. This process occurs in vitamin A deficiency, causing the corneal epithelium to keratinize. This process of the corneal epithelium undergoing metaplasia and keratinizing is called keratomalacia. Let's slow that down. Keratomalacia, malus caret, mal caret? Aha! If your Spanish isn't too mal, you'll remember mal means bad. That's why the donkey is eating a mal carrot. As you can see, the donkey has magically turned into a majestic unicorn, but it's still munching on that crappy-looking carrot. And that's keratomalacia. So what if metaplasia took place on the conjunctiva instead of the cornea? Let's direct you to this adorable girl with a bee on her toe. Uh-oh. I hope she's not allergic to bees. Severe vitamin A deficiency causes bee toe spots to form in the conjunctival epithelium when it undergoes squamous metaplasia, producing localized keratin debris. They look like shiny, triangular gray or white spots, and probably as nasty as bee stings. Notice her pink hem looks like squamous cells, and she's holding a metal plate to remind you that bee toe spots develop due to squamous metaplasia. Oh no, she dropped carrot cake on her pretty dress. It's interesting how the spilled frosting looks like a pair of lungs. This is not a coincidence, people. Vitamin A deficiency increases the risk of pneumonia due to squamous metaplasia of the ciliated columnar bronchial epithelium. She's also got a pancreas pouch, just like Rowdy Kid number 1. Vitamin A deficiency can even cause squamous metaplasia of the epithelial lining of the pancreatic exocrine ducts. This is especially seen in vitamin A deficiency secondary to cystic fibrosis, where the pancreatic ducts are already injured and predisposed to squamous metaplasia. Vitamin A deficiency is also a cause of growth retardation in children and is a major cause of this condition worldwide. While we're outside enjoying nature, take a look at those stones in front of the unicorn and that kidney-looking moss on the nearby tree, which will help you remember that vitamin A deficiency can cause kidney stones. That's most of what can happen if you don't get enough vitamin A. Typically, you'll treat these deficiencies by giving vitamin A orally, or parenterally if the situation is particularly severe. Now let's talk about some other times when we might give extra vitamin A. These vitamin A party hats on top of a wrinkly picnic blanket are here to show you that topical vitamin A is used to treat and prevent wrinkles. You'll also see hairy grandpa chewing some carrot cake with his mouth open. Gross, grandpa. The white buttercream icing on his tongue represents oral hairy leukoplakia, which is due to Epstein-Barr virus. This can also be managed with topical applications of vitamin A. Vitamin A also treats acne and can be given topically or orally, though topical treatments are usually tried first. Vitamin A derivatives, like retinoids, inhibit follicular epidermal keratinization, which loosens keratin plugs of comedones, aka zits, and facilitates their expulsion. In addition, they also shrink sebaceous glands and reduce sebum production. While topical vitamin A is used very commonly, only people with severe cystic acne with scarring or those who failed topical therapy and/or antibiotics should be put on oral vitamin A. Typically, the oral vitamin A derivative prescribed is isotretinoin. We'll have this boy eating an A-shaped icy treat to help you remember isotretinoin. Let's take a look at that pimpled teen again. He's wearing a Go Pro shirt, which represents acute promyelocytic leukemia, or APL. You can learn more about APL in Sketchy Path, but for the sake of this sketch, just know that all trans-retinoic acid, or ATRA, treats APL by causing immature myeloblasts to differentiate into mature granulocytes. Vitamin A doesn't only treat oral hairy leukoplakia. The other is that cough, coryza, conjunctivitis, and coplet-causing rodent of a virus. Yes, measles. We'll bring in our party hat-wearing measle weasel from the paramyxovirus sketch. That's because patients with measles are more susceptible to keratitis and corneal ulceration. As if the conjunctivitis alone wasn't enough of a problem. So we started giving vitamin A to measles patients, and it turns out vitamin A not only prevents and treats those ocular complications, but decreases the risk of other comorbidities, like pneumonia, encephalitis, and diarrhea, as well as recovery time and length of hospital stay. Just remember, measles may have 3 C's, but it only has 1 A. Finally, oral vitamin A may slow the progression of retinitis pigmentosa, which is represented by this deflated, dirty retina balloon. The mud looks just like pigments found in the retina. Just know that the use of vitamin A here is still a little controversial, as it's unclear whether small potential benefits outweigh the potential risks. Speaking of risks, let's now talk about what happens when you have too much vitamin A. You'll see a girl wearing a parka in the middle of summer. She's here to celebrate her friend's birthday, but also to remind you that vitamin A toxicity can be seen in northern climates. The most classic example of dietary vitamin A toxicity comes from the Inuit, a group of indigenous people from northern Canada, Alaska, and Greenland who may eat polar bear and whale livers, which are rich in vitamin A. Tasty. Our friend in the parka is also holding an icy treat to remind you that isotretinoin can also cause vitamin A toxicity. Let's talk about what happens when you take too much vitamin A in the acute setting. Unfortunately, it looks like our northern friend is not having a fun time. She just played pin the tail on the donkey and now her vision is all blurry from the blindfold. She also threw up because she was dizzy. Poor thing. But at least she's helping you remember that acute vitamin A toxicity causes nausea, vomiting, vertigo, and blurred vision. We just mentioned that you can get vitamin A toxicity from eating liver. Chronic vitamin A toxicity can also damage your own liver, or make the liver huge. Like that huge liver birthday present. Wait a second, that's not the birthday boy. Hey kid, go easy there, it ain't your birthday. Little punk. I think this little whippersnapper might have stolen some candy too. Look at those red lips. No wonder he's all hyped up. Anywho, another feature of chronic vitamin A toxicity is cheilitis, or inflammation of the lips. I was afraid I was going to have to go deal with that myself, but Pops is here. He's trying to hold his son's elbow so he doesn't open any more presents and ruin the birthday party. Actually, that looks a little painful for our troublesome friend. Just like Dad, chronic vitamin A toxicity can cause arthralgia or joint pain, including the elbows. Welp, there goes that wig. How embarrassing. Oh well, at least this will help you remember that chronic vitamin A toxicity can cause alopecia, or hair loss. Chronic vitamin A toxicity can also cause hyperkeratosis, which is a sudden and massive abundance of carrots. Ha! Gotcha! Hyperkeratosis is actually thickened dry skin. But you believed me for a second, right? Finally, one of the most worrisome sequelae of chronic vitamin A toxicity is pseudotumor cerebri, or idiopathic intracranial hypertension, which is represented by a big bulging face balloon. Idiopathic intracranial hypertension, or ICH, occurs when there's elevated cerebrospinal fluid pressure in the brain. Though it's hard to observe that directly, break out your ophthalmoscope and you'll see papilledema, which is swelling of the optic nerve. That's why the bottom of the balloon looks like a retina. For more on ICH, check out our video in Sketchy Path. AA Ron is taking his last chance to demonstrate just how different he is. It wasn't enough to have carrot cake, he had to get a freaking tarantula piñata? I think different in this case just means genuinely weird. As always, the tarantula is the symbol for teratogenicity. One of the most important things to remember about vitamin A and any of its derivatives, like isotretinoin, is that it's highly teratogenic. Therefore, a female patient requires a negative pregnancy test and 2 forms of contraception before starting isotretinoin. This is also followed by monthly pregnancy tests. Well, that's a birthday party you probably would skip. Anyway, let's quickly review before getting out of here. Vitamin A and its derivatives are derived from retinol esters and beta-carotenes. Vitamin A is fat-soluble and important for cellular differentiation and vision. Not getting enough vitamin A from the diet, pancreatic insufficiency from chronic pancreatitis or cystic fibrosis, intestinal malabsorption from inflammatory bowel disease or bariatric surgery, and cholestatic liver disease are some of the causes of vitamin A deficiency. The earliest finding of vitamin A deficiency is nyctalopia, or impaired night vision, which can lead to blindness if left untreated. Other findings include keratomalacia of the cornea, Beto spots in the conjunctiva, pneumonia, growth retardation, and kidney stones. Topical vitamin A treats wrinkles, mild to moderate acne, and oral hairy leukoplakia. Isotretinoin, an oral form of vitamin A, treats severe cystic acne, acne with scarring, or when topical therapy fails. All-trans retinoic acid, or ATRA, treats acute promyelocytic leukemia. Vitamin A is recommended in measles as it improves recovery time and reduces risk of complications. Causes of vitamin A toxicity include increased vitamin A consumption, which is usually seen in northern climates where people eat polar bear and whale liver, and taking too much isotretinoin. Vitamin A toxicity causes nausea, vomiting, vertigo, and blurry vision in the acute setting. Chronic vitamin A toxicity causes liver enlargement and injury, cheilitis, arthralgia, alopecia, hyperkeratosis, and ICH. Finally, vitamin A derivatives, like isotretinoin, are teratogenic, and female patients who are planning on taking them require a negative pregnancy test and 2 forms of contraception before starting.